This is an ethical doctor segment. It's concerning chronic vaginal infections. I did several talks recently. It's June 27th, 2011, on Progressive Radio Network concerning this. I had a call in about having chronic vaginal infections, so I'm here to discuss that. When you have a chronic vaginal infection, the cervix, which is about 6 centimeters in width and about 9 centimeters long, there are glands that are down in the lower cervical area. Okay, I've got to get here. These glands are called the Nabothian cysts, and they create what's called the mucus plug for the cervix and uterus. So this mucus plug helps prevent bacteria from the vagina coming up into the sterile uterus. That's how it's planned. So Nabothian cysts, cervix is about the size of a quarter, and basically the mucus plug helps prevent bacteria and viruses getting into the uterus and causing infection up in your female areas so that you can stay reproductively active and have children. When bacteria or viruses can come up into the area, they can destroy the fallopian tubes and ovaries and create a great deal of pain. Again, the normal cervix is about the size of a quarter. A large cervix with many Nabothian cysts on it can be the size of a Coke can and even larger. So we have a normal cervix without very many cysts, and we have a cervix that can become enlarged from chronic infection. And how this can look actually is you can get a cervix that's actually bigger than a uterus. The cervix can actually become bigger than the uterus. And this is called gigantica, and this is an area that I've written about for more than 20 years now. Seen thousands of cases. Everyone's told there's nothing wrong because doctors are seeing big cervixes, but they're not relating what the vision of the big cervix is to what the disease may be. And this chronic inflammation is coming from the infection, and all these glands develop to make mucus to try to fight the bacteria and viruses so that the cervix gets bigger and bigger and bigger. And chronic discharge, so that some women are constantly having a foul odor because of the amount of mucus. I've seen hundreds of cysts on the cervix, hundreds. And surgically they need to be removed and drained. But the technology that existed in routine GYN is very barbaric and pathetic. So I created plasma state process, and what we can do with that is we can drain all the cysts, empty them out, and reconstruct the cervix back to a normal size. This can be done within probably maximum a half hour as an outpatient using the argon beam application for plasma state surgery, and send the patient home the same day, healed in about 6 to 8 weeks, relatively no pain. There is discharge from the surgical procedure, and also discharge from the draining of these mucus glands. There are so many that were there that they're still draining out. And what you try to do is eliminate as many of these cysts as possible. So you can kill, the bacteria, but if you have created all of your body in trying to protect you, has created all these cysts, there's a reality that those cysts need to be drained and removed and the cervix reconstructed to a normal size. So female reconstructive surgery of the cervix is real, and the Institute, the Huffington Bioethics Institute, we are here to train and teach surgeons to do this and teach them what medications to use before the operation, after the operation, and then while you're healing, and also what kind of program each person should be on. Different infections require different programs. Right now, basically it's misdiagnosis at the time. Women are told they have prolapse and end up having a hysterectomy because of the misdiagnosis. So it's an area that needs a great deal of work. And the first work is to educate the women. The women don't even know. They never looked at their cervix. They don't know they have a big cervix. They don't know they have all these mucuses. And it's not really talked about that much, you know, and yet it's very common. And it causes the discharge, the odor, pain, and the belief that you have a prolapse when you don't. You just have a big cervix. And that big cervix can be reduced without destroying your reproductive organs. It can be just reshaped and drained of all the cysts. So that's what cervical female reconstructive surgery is about in relationship to chronic infections and gigantica with many, many fallopian cysts on the cervix. This should help many women, and you need to know about it, but most women end up with a hysterectomy for prolapse or go without treatment or are just told there's nothing else they can do to take their organs out. So my best to you, please watch our radio shows and our TV shows and learn about your body. Thank you. This is Dr. Vicky.